观众朋友们，晚上好！欢迎您收看由凤凰卫视每周台为您带来的天天话题栏目，我是小诗。白内障呢是一种普遍的眼睛老化性疾病，也是导致视力丧失的最常见原因之一。根据美国眼科学会 AO 的数据，与年龄相关的晶状体浑浊影响了超过2440万40岁及以上的美国人。而根据国家眼科研究所 NEI 的估计呢，到2050年，美国患有白内障的人数预计翻一番，达到大约5000万人。虽然白内障在老年群体中很普遍，但现实生活中我们还是多多少少会听到不少关于它的误解。今天呢，我们就为大家总结了几大常见的错误概念，请眼外科医生 Dr. Billy Pan 来为大家一一理清。Hello, Dr. Pan. Thanks for joining us today.
Thank you very much for having me today.
In spite of cataracts being so common, myth and misinformation about the condition abound. So today we put together a list of 6 common misconceptions today. Please help us to clear up and learn the truth.
Absolutely, happy to.
All right, myth number 1, cataracts only affect seniors. Is it true, and what's the fact?
Cataracts are, first of all, an opacification of the natural lens that we were all born with. So as children, we all have lenses in our eyes. As young adults, we have the same lenses in our eyes that are very clear. But as time goes on, as we age into our 60s and 70s, the lens in our eye starts to opacify. It starts to go from a clear color, and it tends to turn a light yellow at first. And at that first sign of a change in the color in the lens, we typically call that the change from a clear lens to a cataract. Now, as the cataract continues to age, it will go from a light yellow to a dark yellow to a brown, and then eventually almost turning black as time goes on if the cataract has never been removed in that patient with surgery. So the typical cataract is what we would consider an age-related cataract that comes with time that everyone gets, that starts in the 60s and then develops during the 70s and oftentimes is removed towards the mid to late 70s.
Okay, that means people can actually have age-related cataract in their early age, but because of most cataracts are small and do not affect vision in the middle-aged people like 40, 50, or until 60, let me not notice the effects until years later, like 70, 80.
Cataracts themselves, usually we do not see them in a patient's 40s and 50s. We usually don't notice them until a patient really hits the 60s. Now, interestingly, in the 40s and 50s, the lens in the eye, it starts to harden, and it loses some of its natural abilities that it once had when a patient's very young. And so that is something that we see in a patient's 40s and 50s, and oftentimes we will call it a dysfunctional lens syndrome, but it's not quite at the level of a cataract yet. A cataract really does tend to, for the average age-related type, pop up in the 60s.
Okay. I read a report from National Eye Institute. It says by age 80, more than like half of all Americans either have a cataract or have had cataract surgery. That's a really large percentage. Your thoughts?
By the age of 80, either a person has had a cataract surgery already, or they have a cataract that is pending surgery or growing still and will eventually get surgery. So basically all patients fall into the camp at that time of either they've had surgery or they need it soon.
Got it. Is the age-related cataract the only type of cataracts, or are there any other types of cataracts as well?
Age-related cataracts are the most common type. However, cataracts can happen even in younger patients. And there are a lot of different causes for younger cataracts. And some of them include just congenital. Even children right out of the womb can potentially have cataracts, and those can have devastating consequences if they're not addressed quickly. And other things that can cause cataracts that are maybe a little bit more typical that we see would be diabetic cataracts in patients who have diabetes, who have poor blood sugar control. Trauma to the eyes can cause cataract formation, such as physical trauma from an accident, or let's say there was an altercation, physical altercation. Also, inflammation in the eyes itself, something that we call uveitis, that can cause cataracts as well. And there's also different medications and sometimes different chemicals that we don't see as commonly now, at least in the United States, that have a side effect of creating cataracts.
Yeah. Speaking of diabetic cataracts, are you talking about type 1 or type 2 or both?
Both. Either type 1 or type 2 diabetics can get cataracts, diabetic cataracts, assuming that the blood sugars are poorly controlled.
Yeah. Other side is, when people are getting older, it is inevitable to take some medicine or surgery for some other health problems. Can certain medications cause changes to eyes that lead to cataracts?
The good thing is medications, the common medications that we take in this country, as well as over-the-counter vitamins and minerals, are not going to affect the cataracts in either a positive way, meaning that it's not going to prevent the formation of the cataracts, and they're usually not going to cause the progression of cataracts either. There's one exception that is something that is a pretty common medication that we do use in many circumstances, which are steroids. Steroid medications can be used in the form of oral steroids or intravenous steroids. They can also be injected. They can be inhaled steroids. They can also be transdermal creams and also steroid eye drops. And steroids, they do have a side effect of potentially causing cataract formation, although the cataracts they cause tend to be what we tend to consider a fast-forming one, not the usual age-related type.
Okay, so are you talking about long-term use steroids to cause cataracts?
Yes, that's a very true statement. I am talking about long-term use of these steroids can cause the formation of cataracts. A quick course, usually in the course of a week or two, which oftentimes steroids are used for short bursts, are not likely to cause any issues towards the eyes.
Okay, got it. So about this myth number 1, the term age-related cataract is a little misleading and it can be confusing because some young people can have cataracts too, as you said.
I agree. Usually what we're dealing with are typically the age-related type of cataracts. However, we have to keep in mind that even young patients can get cataracts. They happen at any time, and we have to keep our eyes out, make sure that we're not missing anything, even if a patient is a younger patient.
Got it. All right, myth number 2, cataracts are caused by overuse of the eyes. Well, to me, it doesn't make sense because otherwise people at a very early age can catch cataracts too.
Correct. So cataracts are not technically caused by overuse of the eyes. They're usually of the age-related type. We're talking about the natural effects of time and reactive oxygen species. And they will grow slowly and eventually, usually by the mid to late 70s, cause problems for patients in terms of their vision. Overuse of the eyes in terms of screen time, also with general reading and use of eyes for visual tasks will not cause a progression of the cataracts. We do know that unfiltered UV radiation from the sun, that can have problems anywhere in the body, including to the eyes, and unfiltered UV radiation to the sun can cause a progression of cataracts. So it's always good to have sun protection when outside with sunglasses and a wide brim hat.
Okay, besides age, what are other actual causes of cataracts?
Well, we talked a little bit about the other ones a little earlier for the ones that affect younger patients. And so in addition to the normal age-related cataracts, patients should watch out for medications that can cause the growth of cataracts, like steroids, and also trauma and infections and poorly controlled diabetes are typically the ones that we would be seeing.
Okay, so the fact of this myth is we can create cataracts through habits. Vice versa, when you have cataracts, you may have trouble reading or doing close work, right?
So the myth is that we cannot create cataracts with overuse of our eyes.
Yeah.
So screen time is not something that patients should worry about in terms of formation of a cataract. And if a cataract does form down the line in the age-appropriate form, then that can potentially interfere with a person's ability to continue to read and to use their screens normally, and that may be a reason to consider cataract surgery at that time.
Okay. Speaking of habits, can smoking cause cataracts?
Smoking can increase the rate of cataract progression, and that's because smoking in general can cause an increased release of reactive oxygen species, which can affect every part of the body, eyes included.
Yes. All right, let's move to myth number 3. Cataracts cause irreversible blindness and inevitable. Why do cataracts lead to blindness?
So cataracts, they can cause blindness. In fact, cataracts is one of the leading causes of blindness worldwide. But cataract blindness is one of these more, is a reversible type of blindness, fortunately, if a patient is able to receive medical attention and surgical attention. So there are other causes of blindness, such as glaucoma and macular degeneration and diabetic eye disease that can cause blindness that's irreversible, unfortunately, but cataracts can be reversed. The great thing about this country is that we do have ready and available access for patients to get cataract surgeries. And we have modern technology that makes the surgery very safe. But unfortunately, across the world, there are parts of the world that do not have the same access to advanced surgical care that we do. And there are patients out there who cannot afford or do not have the resources to see an ophthalmologist to receive cataract surgery. And so cataracts in certain parts of the world does remain one of the leading causes of blindness. But in the United States, it is something that we can readily address.
Okay, so if left untreated, cataracts will eventually cause total blindness. But the good news is that cataracts can be easily treated. Is there anything we can do to slow progression?
Slowing progression of the cataracts include avoiding some of the risk factors that we had talked about earlier, having good sun protection for the head and the neck, including sunglasses, wide brim hat will always be good to help filter out UV radiation when we're outside, especially in sunny Southern California, and also of certain other habits that can increase the rate of cataract progression, such as smoking and cutting that out if the patient does smoke.
Yeah, so people should consider making some lifestyle changes if they have a family history of this condition or are just concerned about the condition or have had already developed the early stage cataracts, right?
Correct.
All right. Myth number 4, surgery is the only option for treating cataracts. I assume this one is false, because what if the symptom is mild, as you said before, and is it still necessary to have surgery?
Cataract, if it has formed, surgery is the only way to get rid of a cataract.
Okay.
The cataract themselves, however, they are on a spectrum of severity, and so early cataracts are usually completely asymptomatic from a patient's standpoint, meaning that their vision is unaffected. And so in early cataracts, there's really nothing to be done except to perhaps change the prescription in a person's glasses or contact lenses as necessary to account for the fact that the cataracts can cause changes in a person's prescription. Once the cataract does get advanced enough where it's affecting quality of vision, then surgery should be considered at that time. But in terms of removal of the cataract itself, we are talking about surgical intervention.
Okay, so what I understand is if people with cataract have vision loss and the blurred vision makes driving or reading other activities impossible, it's time to consider surgery, and it's actually the only effective treatment for severe cataract.
Those symptoms that you just described are very, very typical common symptoms for patients who are at the stage where they should consider undergoing cataract surgery, absolutely. And at that time, surgical intervention is the only option to remove the cataracts and to replace that opacified lens with a clear new intraocular lens made of a synthetic material.
Okay, but is there a rush to get a surgery? In other words, will delaying surgery cause long-term eye damage or make the surgery more difficult?
That's a very good question. And the answer is a patient who develops a cataract has many, many years, if not decades, that they can wait without having any problems. An average age to consider cataract surgery, or range, I should say, should be between 75 to 80. I think many patients at that time, if they have not already received cataract surgery, are probably ready to consider it, or at least be certainly evaluated for it. Most patients will be fine without cataract surgery health-wise in the eyes, even if they don't receive surgery by 80 or even the early 80s. However, if cataracts are left in the eyes long-term, meaning into, let's say, the late 80s or 90s, or as our population continues to age and people live longer, even into the mid or late 90s, that is a time where if the cataract has not yet been removed, it can actually cause health problems for the eyes, and it should be considered for removal at the time for the safety and the health of the eye beyond just improving vision at that time.
Got it. So it sounds like a wait-and-see situation. Just closely monitor the cataract for any changes.
Absolutely. As long as a patient is under the close watch of an eye care professional, at least on a yearly basis, in those age ranges, then I would be comfortable trusting that that patient would get the surgery they need at the right time.
All right, so the fact is you may not need surgery if you still see well. All right, myth number 5, cataract surgery is complex and dangerous. I mean, if people have to do the surgery, how safe is it? What's the success rate?
Cataract surgery itself in the United States is a very, very safe and effective surgery. It is one of the most successful surgeries done in the world, actually. And especially in the US, we have a lot of the most advanced technology and equipment available to us as the surgeons, as well as our patients, to provide very effective, quick, painless surgical intervention. So we're very fortunate to have that available to us. In the rest of the world, some places may not have access to the same types of equipment and technology. And in those environments, they oftentimes will use a surgical technique that is completely manual without the assistance of machines that we have here in the US, called small incision cataract surgery. And patients who have that type of surgery still do very well. And the surgeons who accomplish those types of surgeries are also an incredibly talented group of surgeons. So regardless of where a person or a patient gets surgery across the world, we have a lot of tools at our disposal to be able to provide very safe, efficient surgery for patients. And once again, in the United States, we have access to the best technologies, the best equipment, the best lenses to really give the optimal outcomes that patients are seeking.
Okay, so it is safe, generally speaking, since it's the most frequently performed and successful operations in the States. But as with any surgery, to be honest, risks do exist, right? Like complications.
That's also very true. There is no surgery in the world that is 100% safe. There are always potential complications and potential risks with anything, regardless of how safe it can be. And those are really good questions to have and to discuss with an individual's own surgeon before surgery to get a better sense of the benefits and the risks and weighing those out before proceeding with any intervention.
Got it. Is cataract surgery an outpatient procedure or inpatient? How long does it take?
Cataract surgery now is almost universally an outpatient procedure. In terms of the duration of the surgery itself, it's usually going to be fairly quick, anywhere from 10 to 20 minutes, maybe 30 minutes
really
for the surgery. It's a fairly short surgery, sometimes even faster than that. The duration of healing tends to depend on how dense and how advanced the cataract is. For younger cataracts, and when I say younger, I do mean patients that are usually in the 60s and 70s when they get cataract surgery, we can expect that the recuperation and healing time is probably within 1 to 2 days. In patients who are, let's say, 70 to 80, it might be 2 to 3 days. So it's still a very quick recuperation process with a very quick surgery as well.
And it sounds like a minimal incision.
It's a very minimally invasive surgery. Tiny, small incisions in 1 to 2 millimeters in size because of all of the equipment that we have available that makes it possible for us to do these such small, delicate surgeries now.
Yeah, and for most of people, normal activities can be resumed the day after the surgery, right?
Most of the patients will be able to resume normal visual activities. Physical activities are also, to a reasonable extent, perfectly fine. We usually tell patients to abstain and to rest and stop any heavy physical activities
like
for
lifting
heavy things for about a week, I think, is a reasonable time period.
Great call. Can patients notice an immediate improvement after surgery, or is a gradual improvement over several weeks?
Most patients will notice a pretty quick improvement. Not immediately, within the first few hours, it's going to be blurry. But I would say within 1 to 2 days, patients are noticing that things are improving. And usually by the end of the first week, patients will notice a substantial improvement. But the eye continues to heal and continues to adjust even up to 4 to 6 weeks after the initial surgery.
Got it. All right, Miss number 6. Cataracts can grow back after surgery. I think a lot of people's concerns to decide if they should do the surgery, because some of them may think since it's going to grow back, there is no necessity to do the surgery.
So that's a good question, and a lot of patients do hear about cataracts growing back or have questions about it. And that's not true. Cataract surgery, once it is performed, it is done forever. Each eye will eventually develop a cataract, so each eye will eventually have one cataract surgery. And once the cataract is removed successfully, it will never come back. However, what can happen is something called a secondary membrane. And some patients may hear of this as, or hear of the term secondary cataract, even though it is not strictly true. It is not a return of the cataract. What is happening is a very fine film is going to potentially form behind the acrylic lens that is placed at the time of surgery. And if that film forms, and not always, but commonly it does, it can cause blurring of the vision that makes a patient feel like the same symptoms that they have when they had the original cataracts. But it is a completely separate issue. That film, if it forms and when it forms, can be removed in the clinic without a surgery with a small pulsation of laser. It's a very commonly performed procedure in clinic.
Okay, so the pivot point here is cataract is not a film that grows over the eye. The cloudiness is actually inside the eye, right?
Correct. Everything we're talking about is a clouding internally within the eye itself.
Okay, so the fact is it won't grow back after surgery, which means it won't cause cloudy vision again, right?
Correct. Cataracts will not grow back, but sometimes these films form that can mimic a cataract, and that can also sometimes cause blurring.
All right. Can cataract transfer from one eye to the other?
It cannot, but each eye will get its own cataract anyways.
So it won't happen like just to one eye?
Age-related cataract won't happen just in one eye. Age-related cataract usually grows fairly symmetrically between the two eyes. But if we go back to some of the things that we talked about earlier, infections in the eye, trauma to one of the eyes and not the other eye, those can cause a progression of cataracts that's faster in that one eye compared to the other side, potentially.
And also, based on what you just explained, I think let's also clarify the misconception some people have that eye drops can dissolve cataracts. Is there any FDA-approved drops that can cure or delay cataracts?
There are not. There have been studies, and there continue to be studies, looking at ways to slow the growth of cataracts, but nothing is FDA approved, definitely not. And eventually, one does look forward to hearing about news of eye drops that can cause the regression of cataracts and for cataracts to potentially disappear. But that's a long ways off. But certainly we would look forward to seeing something like that available in the future.
Absolutely. All right. Thank you so much for being with us today, Dr. Pan. I appreciate that. And we're looking forward to learning more truths about eyes from you. Thanks again.
Thank you. Have a good day.
那也非常感谢电视机前观众朋友们的收看，我们下期再见，祝你晚安。
您正在收看的是凤凰卫视。